Two women. One spent 24 years as a nurse in intensive care and operating theatres. The other, an accredited mental health social worker supporting people through trauma. Like us, many of you have lived inside the systems and have your own lived and living experiences. We're not telling you our names just yet, but we will tell you why we're here. There's a wound for frontliners that workplaces won't name, and it's not just burnout, it's moral injury. What happens when the system forces you to choose between your conscience and your calling? We've lived it. Our differences are what creates unity, and the conversations that heal happen between peers. That is what Between Peers is all about.
I'm going to go back to a Reddit post, but there's actually a comment in a Reddit post which sort of typifies the whole thread, but it's quite articulately written. So it's on nursing again, so and probably American based. So this is a registered nurse in the ER. So I recently had an old guy get mortally offended when I told him kindly that I was married and wouldn't and couldn't go out with him, and I was wearing my wedding ring. He huffed about that and went on to complain that he had asked all these different nurses out and they'd all shot him down. I had to explain, skipping the part about how he was not an appetising prospect, that dating a patient is an ethical breach and a nurse could lose her licence for it. I hope it was enough to make him leave any other nurses he encountered alone. She also adds that the entire time his even less appetising son was sitting there completely annoyed and occasionally telling Dad to shut up. And I think this feeds into the sexualising of nurses. You know, like there's a whole erotica genre for women about, you know, wartime nurses and, you know, Florence Nightingale and the romanticism of being a nurse and falling in love with your patient and living happily ever after, or the, you know, becoming a nurse and meeting a doctor and marrying well.
But if you think about it, like, let's look at it.
Then the whole
if you go to adult bookshops or adult stores, there's nurses' uniforms, you know.
Yeah.
There's, if you go back in the day, the Mills and Boone, you know, like it's...
Not back in the day, it's still current.
Oh, is Mill and Boone... Oh, Jesus.
Still current.
Oh, my God, righto, whatever. I can't believe that. I didn't know. Obviously, I don't read them. But you're right. There seems to be... That's definitely one profession that it has been painted with a, I don't know if it's a storyline or social conditioning, combination of all the above, where nurses are kinky.
Yeah.
And nurses are very sexually deprived and look for anything and any action at any time of the day and a good time. And I have seen and heard that said to me and to my peers fairly regularly.
I know it's different now, but I still remember... No, I don't want to show my age. Shit.
As you talk about drinking from a garden hose a couple of...
Yeah. Well, I mean, many lifetimes ago...
Oh, God.
When a person that I know, a flatmate of mine, graduated in the late 90s from nursing school, and the uniform was still quite sexualised for a public hospital.
Well, that's fine when you're talking about that, but...
You know, like a major public hospital, it was a well-known one.
Well, during my training...
Like the smocks and the hats and everything.
Well, when I was training, I trained through a university that was just Victoria-based, okay? And then it amalgamated and it's now known as the Australian Catholic University. And I'm happily to say this because this was so many years ago. But the original uniform, look, it's since changed, but the original uniform was a grey dress. And you had to hitch it up high to put one knee on the bed to help lift and move a patient around the bed so you could see straight up. So pride and modesty was not there. You couldn't cover your undies. Like
it's not practical for what you're expected to do.
No, it's not. But
I guess that's what we're saying, right?
Absolutely, right? So, and it then still perpetuates into that sexualisation and that, or false sexualisation fantasy. If those uniforms way back then, look, it's not practical now. They're going more towards the scrub look more than anything now. But
and pants and shirt, and it's, unisex uniforms, which is thank goodness, because there's more male nurses now, thank goodness.
Yeah.
And non-binary, you know what I mean? All gendered nurses, let's just say that.
But in my awareness and strategy of understanding, how many people way back during my days of training, and I trained down in Victoria, that we literally were exposed to uniforms that only helped this fantasy.
Yeah, exactly. This is just my point.
And back then, now look, I am talking late 80s, early 90s, that sort of period of time. The uniform was a gorgeous soft grey, right? Had to have it, and it was a grey with a navy vest as the accessory. But we had to wear a dress, and the dress, if it was too long, it became a hazard. So if it was below the knee, it became a hazard and inconvenient trying to move patients on the bed. So you needed to be short enough so you could move in it, but there was a very fine line between short enough to move patients versus being able to be, depending on what you had to do, where it became inappropriate. And it was a very, very fine line of modesty and comfort. And as soon as a lot of the hospitals, and we're not just now talking any of all hospitals now, because I have worked in a lot of the different states on the the whole eastern seaboard, where you now have the option of pants. And yes, we're supposed to be a non-lift hospital, blah, 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 blah. Yeah, I get it, but let's be honest, that's not always practical. That at the end of the day, it just allows better movement and modesty to be played, but there's still that hypersexualization in play.
Well, I just looked it up because we were talking, and of course, I wanted to know a little bit more about the hypersexualization of nurses, and so I asked, is nursing still a major genre in pornography?
Oh, yeah.
And it said, yes, the nursing or sexy nurse trope remains a highly recognisable and recurrent genre in both traditional adult entertainment and independent creator-driven platforms. While it may not command the same singular dominance it did in the VHS era, so in the 80s, when you were talking about when your uniform came, in 90s, the genre's longevity and prevalence remain sustained by several factors. So firstly, pop culture tropes. The naughty nurse is deeply embedded as one of the most visible sexual stereotypes in Western media. And I'll say across all media. I mean, look at Grey's Anatomy. Everyone's shagging everyone, It continually resurfaces in mainstream television, magazines, and costume culture, keeping the concept fresh in the public imagination. I mean, even Halloween costumes, the sexy nurse. You've got the sexy nurse, the sexy bunny, right? Platform shifts, OnlyFans. So the format of the genre has adapted. While the rise of independent creator platforms like OnlyFans, the traditional highly produced nursing roleplay has evolved into direct-to-consume content. Many nurses and adult creators use medical uniforms and roleplay themes as a specific niche to attract subscribers. From a particular type of social work that I've done, I know that within the kink community, there is medical play, where people actually do needle play and all of that sort of stuff. There's also not just the naughty nurse, but there's also the virgin nurse as well.
Yeah.
So there's...
That feeds into that Florence Nightingale era of vision that people do in their head, have their understanding and their image of what, and perception of what they think a nurse is.
Yeah, well, the nursing stereotypes, angels and swingers, right?
Yeah. Nurses are perceived to be kinky as fuck, naughty as fuck, and will do absolutely anything. And that stereotype needs to be burned, because quite frankly, no stereotype should be assigned to a profession that's that derogatory.
They're saying nurses are a profession where nursing staff are often seen by customers as maids or servants, a common occurrence. So maids are another sexualised.
That's true,
one.
yeah.
So are air flight attendants.
Yes.
So are bar staff.
Yeah.
Right.
Because, is there in those areas, is there a common theme of, because they are service industry workers, are they then hypersexualized?
Yeah, I would say everyone across that. And
But it's not.
potentially
But it's the service industry, not the hospitality industry.
yeah, service industry, but which would include the hospitality industry.
But it's not the same. You're not going to get raunchy with a baker compared to a nurse.
Well,
like, look at the visual.
Service within hospitality. Do you know what I mean? Like, yeah.
Like, I could understand like a bar, but I don't see it with a baker. Like,
No.
maybe it's because of the way social media and the way they've done all the industries.
But because it's about power.
Actually, it is, isn't it?
Because the maids, right? These are all have their little sexy outfits. They all have porn genres.
They do. They all have porn
Whereas,
genres, yeah.
You know, I'm gonna ask social work, and that's gonna laugh at me, right?
Absolutely. What a weird conversation to be having, you know, on an afternoon. What you looking up?
I'm looking at social work.
Okay. It won't be the same. It won't give them.
Oh, no, surprisingly, yes. This is something I would not have thought of. Social work is still a widely recognised subgenre of adult entertainment and pornography. It typically falls under the broader categories of workplace or POV roleplay, where the narrative centres around a field agent or caseworker interacting with a client in an intimate setting. While the social worker genre remains active, the broader adult industry has shifted significantly over the last few years. The landscape has evolved in a few key ways. So it talks about subscription, diversification of things. Well, social worker and teacher fall under the same categories. So there's
so that's where the teacher gets lumped in. But then
still heavily searched in a much larger volume of niche, highly specific and amateur content.
But that then points into all frontline workers, because if you think about it because I bet if you keep on Googling and looking, that will then talk about the police officers. Will then, and then obviously go into the ambulance officers and...
So uniforms in general.
Yeah, so obviously there must be a societal perception around uniforms of some description.
And it's around service, all of it. That's, I mean, like I'm just talking generally now. So I would say as well that we haven't really discussed, but I would say nurses would probably quite regularly be essayed by patients.
What I was about to suggest, without actually, but you've actually gone into, was that it then opens up a whole conversation and context around if inappropriate behaviour through to SA or anything else that comes up in the workplace, how do we go about reporting? What's the process of that? How does that, is that an advantage or a disadvantage because of the politics behind the hierarchy system?
Exactly.
And then are people, because if let's go there, if SA is underreported as it is in society around the world currently, is underreported, that would also be underreported in the workplace.
And I guess I'm not talking about the R word there.
No.
I'm talking about smack on the bum.
Yeah.
I'm not saying that is any less or any more, but I mean, this is a difficult subject to talk about and really triggering for many, many people. So please don't think I'm minimising anything. But I mean, even just having to bathe intimate parts of people's body and, you know, a man getting an erection because you're having to clean his penis or wipe, you know what I mean? Like all of that sort of stuff. It just leaves you wide open to be in vulnerable situations.
The weird irony, and look, my brain struggles with this. How come when stenographers do ultrasounds, right? Doctors do procedures, they always have someone there to turn around and basically be a chaperone for the patient, for their safety, right? But really it's safety for everyone, okay?
But I generally think that they are male professions where the profession is in a position of power and the patient or the client or whatever isn't. So it's to protect the man from being accused of...
No, absolutely.
SA.
Yeah, but absolutely. But if that is deemed routine and if that's deemed situation normal, it's sad that we in our industries don't have routine and normal, that it's two people to be meeting bed baths and hygiene needs for patients to protect the safety of the staff because we don't have the right staffing allocation to achieve it. So it boils back down to the hierarchy and money and management and affordability and practicality.
Yeah. And then as well with nurses, you've got that whole nurse-doctor relationships that you see on Grey's Anatomy. I mean, you're there in a...
That was an eye roll, by the way.
Yeah, I saw that. Yeah. But, I mean, like, it's on TV, so it's got to be true.
Oh, God, yeah, absolutely.
I mean, in terms of if you're in a hospital environment and you're doing crazy shifts, like 12-hour, whatever shifts is expected of you, your home life, you're just there sleeping.
That's right.
Do you know what I mean? Like, you've got really no time to meet anyone or do anything. So the only people that you're meeting are in the workplace. How do you actually have relationships?
It's hard. Look, and then again, power dynamic, because if you turn around and have a relationship with someone, is there a power shift where the first person that I had a relationship with was a colleague and I was his superior?
Ooh.
Yeah.
I wasn't expecting that.
Spicy.
You're right. Give me the tea. Probably don't give me the tea. Don't give me the tea. This is a minefield. Oh, my goodness.
You asked.
I mean, so I guess because you're in the workplace all of the time, how do you meet someone outside of the workplace? And then can they even understand what we do?
That's why people end up having relationships within the workplace.
But isn't that now frowned upon?
And then it's
lots of HR shit going on.
And then it's very, very, very toxic because if it goes wrong,
yeah, of course,
then someone has to leave because it's so awkward. The orcs is just awkwarding.
Orcs is just awkwarding.
Well,
I mean, there's a whole lot of don't shit where you eat kind of, and it's good advice.
I wonder why, but how else? How do you
love
live?
is love, right? Like, what can you do? And if you're in those confined spaces and like-minded people and helping professions and savior complex and all of that sort of stuff, like
by the time
it's complicated.
By the time this gets put up, the reality is we're heading in towards winter, right, in Australia. So as a result of heading towards winter in Australia, what you will see, what you'll be attuned to is the fact that the medical profession here, right, is under the pump. We're now going into flu season. Okay, so this is historically and notoriously where nurses are expected to do double shifts. Right. Now, when I say nurses are expected to do double shifts, I'm talking about the nurse that does an 8-hour shift will be asked to extend it to 16 hours.
I thought standard and health
it's not. No, shift. Not every shift is 12 hours. It's 12 hours. It really, really is dependent on which area.
Yeah, okay.
Okay, because it really is dependent on the specialty and the area that they will formulate rosters around the needs of the area. Right, so ICU and emergency department are really good for the 12-hour shifts, but there still has to be 8-hour shifts available. Why? Do you know why?
Work-life balance, I don't know.
No, because 12-hour shifts is only 12, 24, 36. It's only 36 hours. If they're a full-timer, it's not enough hours. They are 2 hours a month. So what they do is so in a month roster, right, they will then do 3 12-hour shifts, 3 12-hour shifts, 3 12-hour shifts, week 4, 3 12-hour shifts plus 1 8-hour shift to cover that 8 hours of 2 hours per week for the month.
Yeah, okay.
So 8-hour shifts still exists.
Yeah.
Right? Now, unless you're in the industry, you don't know. Unless you do 12-hour shifts, you don't know. But there was been times where I was working ICU, where I was working from 7 a.m. to 11 p.m. at night, right? So 7 a.m. because staff called in sick. So I had to work from 7 a.m. to 11 p.m. and 2 days in a row, followed by 2 morning shifts. So for an example, the easiest way to understand would be Monday, 7 a.m. to 11 p.m, Tuesday, 7 a.m. to 11 p.m, Wednesday, 7 a.m. to 3:30 p.m, Thursday, 7 a.m. to 3:30 p.m, Friday, night shift, right? How does that work for our body and our nervous system and life-work balance and just trying to survive?
That's it. You can't, how can you live outside of that? How can you have a healthy family life? How can you have work-life balance? How can you have children? How can you have sleep?
And then the cost of marital breakdowns, right? Because if push comes to shove, if you don't find work-life balance, I mean, relationships break down for all many reasons, but then what do you do? Because if you're then become a parent with children and it's split, then it's childcare, it's everything else with you trying to work those shifts.
Yeah, and doing it on your own. That's
and
not
doing
possible.
it on your own.
That's not possible.
No.
Well,
and this is
people have got to be making it work. I'd like to know how they make it work.
This is exactly the reason why there needs to be intelligent conversations around all these topics. We don't know the solutions. We want to build a community, come up with ideas, and actively try and have intelligent, healthy conversations around what do we want, need, and require as the frontliners. Because obviously the hierarchy have got it wrong, that we need to start having conversations and have direct input ourselves to be the change and to create the change, because the system as it currently stands doesn't exist. Now, on that note, because I have a motto, I like to keep everything sub 23 minutes. We're going to look at winding this topic down. But again, please, as you follow us along on this journey on what we are now creating, again, no topic is off topic, but it needs to be respectful. It needs to be healthy. It needs to be helpful. And we want respectful and healthy and intelligent.
Be mindful of people's triggers as well.
And be mindful and respectful in the comments as we turn around and try and create a community where we can actually start working towards a better system, because the current system clearly, as you're hearing us say, isn't working for us. And on that note, take a breath, and we will see you in the next podcast.